Hi everyone, welcome to 5 Minute Video Study for the NCE. Today we are in counseling skills and we are going to be covering addressing cultural considerations, letter H. And for this competency, um, to me, cultural considerations, or you may hear the word multicultural. So, multicultural competencies, in a general sense, is the understanding that mental health clinicians or mental health counselors should never use a one size fits all approach to treating the clients or in treatment planning. Mental health in general may feel like personal experience. Counselors can only kind of begin to understand things from a holistic perspective, and some of those perspectives would include the biological predispositions, past trauma, as well as cultural values. So when we talk about cultural and identity, we're talking about how, identity impacts cultural awareness, cultural knowledge, and cultural skills, and how those then are manifested in a counseling setting. So, with that said, part of being a competent counselor is understanding that cultural competencies aren't just important, but they are vital for the therapeutic process. And by that, we're talking about cultural awareness, cultural humility, cultural sensitivity. If those are not present in the counseling relationship, then what it's likely to happen is cultural bias, or even worse, cultural discrimination, or some of the negatives of those. So, how can you apply multicultural competencies into the counseling practice? Part of a competent counselor is to identify a counselor's own worldview and their own cultural and values that they have in order to look at their own inherent biases that they grew up with. For example, if a counselor grew up in a monocultural society, or they grew up in a um, economic community um, that most of the community members were in a certain economic class, then their perspectives would, kind of lead to a perspective from that class. Another example is, if a counselor even was able to attend college or go to college, that provided a certain level of enrichment and privilege that certainly not everyone has. So, again, that shapes someone's perspectives, and part of that is being aware of how that could create bias or could create a certain perspective that isn't universal. The other thing that's important to understand is that counselors um, need to understand the notions of diversity, equity, advocacy, and opportunity, and how that influences a person's social, personal, and intellectual functioning from different cultures. Other things to consider is that mental health or mental illness certainly has differences in cultural beliefs as well as mental health stigmas. Other things to consider is that, part of developing a therapeutic alliance or therapeutic approach is to talk and to consider, the different cultural backgrounds rather than either ignoring it or just making assumptions or just saying that, one size fits all for all my clients. The other thing is to self-reflect and to analyze implicit biases that includes ethnocentrism, racism, a lot of the unconscious beliefs that one has carried throughout their life. And then understand how cultural beliefs and values now shape ethics, personal relationships, communication styles, beliefs and behaviors, as well as symptomology. So those are just a few of the things to consider whenever we're talking about ethnicity, racial identity, and multiculturalism.